I'm CBC Toronto's Dwight Drummond, and this is your Ontario coronavirus update. Officials have announced there are at least 43 new cases confirmed in the province, bringing the total number of cases to at least 257. This includes 2 virus-related deaths and 5 cases that are now resolved. The number of cases under investigation in the province stands at 3,972, and the wait period for anyone who has been tested is currently between 5 and 7 days. Health officials in Halton confirmed the second COVID-19 related death today.
At this time, what we know is that the individual did not travel outside of Canada recently, nor was he a contact of a known case of COVID-19.
Halton authorities said the man in his 50s had an underlying health condition. He had been treated at Milton District Hospital and then transferred to Oakville Trafalgar Memorial Hospital, where he died. Officials say they are still in the midst of investigating how he contracted the virus. Health Minister Christine Elliott said the province's coroner will investigate to confirm whether or not coronavirus was the main cause of the man's death. 37 days, that's when Ontario could run out of ventilators and intensive care beds, according to a new report. Our Queen's Park reporter Mike Crawley has more on the study that presents a very worrying scenario for hospitals in this province during the pandemic.
The research team comes from the University Health Network, Sunnybrook Health Sciences, and the University of Toronto. They project what happens if Ontario keeps the rate of new infections down, similar to Japan, which brought in strict social distancing measures. Assuming a daily growth rate in new coronavirus cases of 7.5%, the researchers say Ontario's hospitals would run out of ventilators and intensive care beds by late April. That's little more than 5 weeks from now.
We don't know exactly what's going to happen, but we do know that the pressures on our healthcare system are going to increase.
Since March 12th, the daily increase in new COVID-19 cases has averaged more than 25%. The rate has slowed since Monday, but is still averaging nearly 15%, double the growth rate projected by the researchers. The researchers do say there are 2 ways the hospital system can get through the pandemic. One is if the daily growth rate in new infections is kept below 7.5%. Can the province achieve that? We asked the Chief Medical Health Officer.
I'd like to think we can.
Another way the researchers say Ontario copes? By freeing up 3/4 of existing intensive care beds and ventilators for coronavirus patients, adding 2,000 extra ICU spaces and 600 new ventilators.
We are building our capacity in terms of hospital beds, healthcare beds generally, and in ventilators. We've just increased our in-house supply by 300 ventilators.
One note of caution from the researchers, their forecast is based on assumptions, including how many COVID-19 patients will actually require intensive care. But the report does suggest that the best way to ensure that Ontario's hospitals are not overwhelmed by the end of April is to keep strict social distancing measures in place until the middle of May. Mike Crawley, CBC News, Toronto.
MPPs were back at Queen's Park today in order to pass emergency legislation to help Ontarians through this pandemic. That includes helping keep grocery stores and pharmacies fully stocked.
They need more flexibility with deliveries from the warehouses so they can restock their shelves. Right now, municipal noise bylaws prevent them from accepting deliveries at certain hours. So we're going to bring temporary changes to allow them to accept deliveries 24 hours a day, 7 days a week, so people can continue to get the essentials they need.
The Premier reminded Ontarians to practice social distancing in stores and reassured people that there is supply in place, so there is no need to panic buy. The province also looked at legislation today to protect workers who take sick leave.
No one, I repeat, no one should have to worry about losing their job because they're putting their own health first, or because they're putting their family first. And that's exactly what this legislation will do.
The legislation would ban employers from firing workers who take time off, either because they are sick with COVID-19 or self-isolating. Employees who take time off to care for an ill family member or to care for a child because of school and daycare closures would also be protected. Ford also announced that all eviction orders will be suspended until further notice. Renewals for driver's licenses, license plate stickers, and health cards will also be suspended during this time. Only 24 MPPs were in attendance at the emergency meeting today to allow for social distancing. Following technical difficulties with Telehealth Ontario, the province announced it has added an additional 1,300 lines. This comes after the province-wide hotline had major issues yesterday, asking people to call their local health units instead. The Ministry of Health says 13,500 calls were made to telehealth yesterday. Toronto officials say most non-essential businesses in the city have shut down following orders from the province, but there are some outliers continuing to operate.
I'm encouraging non-essential businesses that remain open to get behind social distancing. I'm encouraging these businesses to do the right thing.
Businesses that don't comply could face a fine. The city is dealing with 128 confirmed cases of COVID-19, with 11 people being hospitalized. Officials are reminding residents to be vigilant of scams involving products and services related to the coronavirus. Around 150 Toronto transit workers have been sent home after the agency's first confirmed case of COVID-19. The employee was working at a service yard last week. As Nick Bover reports, there's concern more TTC employee cases could put a major strain on the transit system.
At the TTC's main hub for repairs and maintenance, one building and its staff are out of service today.
As a precautionary measure, we started making phone calls last night, went in this morning, talked to everybody, and made the decision that we're going to close the facility down.
The swift closure comes after a mechanic tested positive for COVID-19 last night. The employee worked one shift after returning from an international trip last week. So everyone who may have been in contact with them has been sent home. That's between 130 and 170 people. TTC CEO Rick Leary says they can handle that blow for now.
We're not at 100% service. We, like everybody else, have seen a slight taper down, recognizing people being off, but we're still providing a good quality right now.
But the union representing transit workers says that could change quickly. The building shut down by the positive test does non-urgent vehicle rebuilds. If it happened at a more critical facility, it could be a very different story.
They're basically doing overhaul jobs, and they're fixing vehicles that are going to go out in maybe in a few weeks or a couple of days. So they're not our bus garages or our streetcar yards or our subway yards.
Leary says the TTC is well aware that more cases could put hundreds more workers on ice.
Are you worried, though, that at a certain point, if, say, a few more people get sick, that you could reach a point where things become hard to maintain, even at these levels?
But yeah, reality has it that, that could very well happen, and we're just trying to stay on top of it right now.
The agency says it has taken more steps to keep its workers safe, including more thorough cleaning and allowing workers to wear a mask on the job. Nick Boisvert, CBC News, Toronto.
A local distillery has found a unique way to help in the COVID-19 crisis, retooling to produce hand sanitizer. The Spirit of York Distillery is one of several facilities making the switch. They looked up a World Health Organization recipe, made a few operational adjustments, and started churning it out. They are selling the sanitizer through an open window and donating the proceeds to food banks. The distillery's owner says they've seen huge demand for the product.
We've been going now since we decided to do this, super long hours, early in the morning till late at night, trying to get this done, trying to get product out. I'm a bit of a proud Canadian. That's what we do, right? We rally and we help each other.
Yes, we do. The business says several other companies chipped in to make the switch possible, donating labels, bottles, and even boxes to package it all up. And remember, you can always find the very latest right here at cbc.ca/Toronto.